Welcome back. If you're a senior and need some extra assistance, the West Virginia Bureau of Senior Services can help. The Bureau is a cabinet-level state agency that oversees services such as meals and transportation, in-home care, Alzheimer's respite, wellness and Medicare counseling. Joining me to tell us about those services is Robert Roswall, Commissioner of the West Virginia Bureau of Senior Services. Commissioner, thank you so much for being here.
It's great to be here.
Yeah, I know your agency offers a lot of needed services to seniors. It's so important to the state of West Virginia. But right now is a really good time for us to talk about the health insurance marketplace because it's an open enrollment. Can you tell us about that? Because it is critical for seniors to understand.
It's open enrollment for Medicare Part D. That's their prescription drug benefit program. They need to have that checked every year, because if their prescriptions change, there's potential that the formularies have changed, that the prices have gone up. They can come into the office, they can call, we can go over that with them. We can show them what programs are the best. We still allow them to choose which one they want because they'll differ in deductibles and such. But it gives them the opportunity to make sure that they're in the best program that best suits them. And it's all an individualized program and highly related to the prescription drugs that they take.
Now, I know that this happens every year, and there is a lot of information out there, and I know that there are seniors that get very confused about it. They don't know what to do. Who do they call? How do they get access to the counselors that can help them with this?
Well, they call the Bureau of Senior Services, and they would call our toll-free number, which I need to look at it to give it to you to make sure I give you the right one. It's 877-987-3646, and that's the one that specifically goes to the Bureau. And that will get you to all of our services in the Bureau of Senior Services.
Now, when they make that phone call, if they're interested in this particular program, I know many of our seniors, transportation is an issue for them. Are there local resources, or most of this done by the telephone?
Most of it's done by the phone, but we have counselors in probably 38 of the 55 counties. But it's done on the phone. You give us the information on the phone. We put it all on the forms. We send it out for you to check. You mail it back to us, and then we process it all. It's all processed electronically.
And that's really, I think, so important for everyone to know that 800 number and know that resource is there for them, and that they don't have to travel necessarily to get out to get the resource. That they can do it by phone.
Correct. It's convenient.
It is very convenient. I know that you're always looking for volunteers.
Yes.
We always need people to help our seniors. Can you talk a little bit about how a person might volunteer in different parts of the state, and what is the process?
Well, our volunteer opportunities are local. We have a local provider agency in all the 55 counties. So those opportunities are at your local senior centers, even the satellites of those centers. We're always looking for people that can help in delivering meals, help in programs within the center, people that can lead exercise programs, especially evidence-based exercise programs, people that lead programs on where they're doing quilting, crocheting, there's sewing classes. There's all kinds of opportunities. They can be at the nutrition site and help serve the meals to the people that do not have the ability to walk up to get their meals. So there's always opportunities, and they all vary by the counties that you're in. So we encourage people to check with their senior centers and see if there's something they can do to help them out.
I think it is important for us to give back.
Yes.
Volunteerism is key. So many people have given back to us over the years, and now as people age and they become seniors, they need more assistance. But I know that your bureau does a lot more than just help with open enrollment during Medicare Part D. I mean, you do all kinds of things.
Right.
Can you talk a little bit about some of the other services that people can get access to through your bureau?
Well, since you said Medicare open enrollment, let me emphasize that December 7th is the deadline.
Oh,
that
okay,
is the
that
deadline
is key.
that they need to make sure they've taken care of that. We also deal with the Affordable Care Act. We're in a marketplace for that. That goes until January 31st, that you can apply for that. But if you want it to be effective January 1st, you need to have it done by December the 15th. We do a lot with that. Then we do in-home care. We do lottery programs. When you hear people talking about and advertising lottery dollars for seniors, that's our in-home care program, that's our transportation, and that's also our Alzheimer's programs. We have those available in all 55 counties. We fund roughly 800,000 hours of in-home care with the lottery dollars. From that, we ask for a token $1 an hour donation. we get enough donations to do another 50,000 hours of services. So it's good that people also feel like giving back to the program so that we can extend that program to other people. We're serving probably about 2,300 people on the Lighthouse program and about 1,000 people on the FAIR program, the Alzheimer's program.
That's great. I mean, it is wonderful. If I were interested in that program, if I, had a parent, a loved one, someone that I knew needed some in-home services, how would I go about applying for those services that you talked about?
All of our programs are focused locally. So almost every application you want to do, you do locally. Do at your local senior center, your local county aging program. They can help you with all of these. The ones that are CHIP, which is the Health Insurance Marketplace and Affordable Care Act, that's primarily a Bureau-funded program, but you can start at your local senior center. That's our focal point. We've designated them as such, and that's the entry point into senior services.
Now, if I were interested in a list of phone numbers, how to get in contact with my local agency, would I go on your website to get that?
Yes, you'd find that on our website, which is wvseniorservices.gov.
And on that, I would be able to find specifically where I would need to go to in a particular county.
Yes, there'll be trigger points that tell you where you can find those. It'll tell you about each program. It'll tell you about nutrition program. And it gives you a lot of information on other things. And all of the library shows are linked onto that website also.
That's great. I know there are going to be challenges for us ahead, but I certainly appreciate the work that's done in the Bureau for Senior Services. If there was something to tell the viewers, sort of a last comment, what would you say about what we do for helping seniors in the state of West Virginia?
I think we try to do the most efficient delivery of services that we can do. We try our best to target those with the greatest need, and I think we do a very good job of that. And we do a lot more than the revenues that we spend. Our local providers raise a lot of money to continue to offer services far above and beyond the federal and state dollars.
And that's great. And that's great to know that we do that. And thank you for acknowledging those local groups, because I do think it is very important. The state puts an emphasis on it, but the local individuals out there that are campaigning to help our senior centers, good for them.
Yes, absolutely. We're glad to have them, and they do great work.
Thank you. Thank you, Commissioner. When we come back, we'll talk with someone who spent more than 10 years as a caregiver, taking care of a loved one suffering from Parkinson's and Alzheimer's disease, how she handled it, and her message. Coming up.